we go. And there we are on Facebook.
Take my phone, put your phone on.
And then when we're on the mic, you just want to be not right up on it, but about like that close. Perfect. And good morning, Rim Country. Chris Higgins in the studio. Hope you're having a great Monday morning and hope you had a wonderful weekend. It was nice, a little bit of weather we got. So enjoyed the rain and all the cold weather and everything else it brought. Again, hope you had a good weekend for yourself. In the studio this morning, we have a couple guests that are with the Eastern Arizona College EAC Payson campus with the nursing program and allied health program. We have nursing program coordinator Ty Jones and the allied health coordinator Heather Perry. Good morning to both of you.
Good morning.
Good morning.
How are you two doing this morning?
Doing great.
Hey, there
Yeah.
we go. I know. Have your drinks and
Yes.
there we go. Ready
Yeah.
to go to tell everyone about the amazing, incredible, and awesome nursing programs and allied health programs here in Rim Country that
Yes.
the EAC Payson campus offers. And I guess we should start with a little bit about the history of the programs. And Heather, before the program, you were sharing with us that you were in the second program that went through the campus here.
Yeah, and EAC Payson, I think that they started in 2003 or 2002, they brought their nursing program. And I was fortunate enough to enroll, and yeah, very exciting time. So I graduated from EAC myself, and now I teach there full time.
Nice.
Yeah.
Nice. And Ty, you also are an EAC graduate?
I'm a 1985 EAC graduate. No, I didn't they didn't
Hey,
have a
whoa,
nursing
Heather,
That
program.
was the year I was born.
Heather, whoa, this is not scripted. We're going off the script right now. Going off the script.
No
Sorry
wonder
about
you get
that.
all your advice from that.
Yeah, no. Gosh, Ty, we didn't set you up. Honest. That wasn't, part of
But
that.
the EAC didn't have a nursing program then, but I ended up getting my credentials 10 years later in 1995 through the University of Maui, or Maui University in Hawaii, and then moved back to Payson that year and went to work for, at that time, Payson Regional Medical Center.
Nice. And I think that's when we met. You were working for PRMC.
Yeah.
And
Yeah.
that's a
I used
few
to get
moons
coffee
ago.
from you every morning.
Yeah.
Yes.
That's when I met Ty too. I was 13 years old,
Yep.
and I was working as a volunteer.
Volunteer.
And I worked exclusively with Ty. So Ty has been my mentor
Yeah.
for
long
23 years.
So
Long
she's
time.
allowed to make comments like that.
Yeah.
She's earned it. She's if
I've
she's-
been here long enough.
If she's known you that long
Right.
time.
I make sure she's working wherever I work.
Yeah, right. Oh, that is good. So,
Yeah.
the programs, they have been around here for a while and just doing a wonderful job. But first, I want to talk about the opportunities because high school students, you work with a lot of high school students,
Yep.
and there's a lot of opportunities for the
Well,
students.
EAC offers a lot for high school students, not only in the what we call NAVITS, Northern Arizona Vocational Institution of Technology. They offer a dual enrollment program for not only allied health, but also for cosmetology. We had a fire science program at one time. But then also EAC offers what we call dual enrollment for high school students who are at Payson High School. They have an opportunity to obtain an associate's degree or at least be on a pathway to obtain an associate's degree. And the great news is that all the credits transfer directly from EAC to the state universities. The classes all take place right there at the Payson High School campus. And we have partnered with Aspire Arizona to actually provide the tuition for free for those students. So they can dual enroll, they have the opportunity to get both high school and college credits, but again, be on a pathway, and really they could obtain their associate's degree while they're there in high school. 100% again covered by the Aspire Foundation here in Payson. Amazing.
Now, are there programs in the nursing program, are there certificates that high school students could also earn?
Yeah. So the NAVIT students can come, and so NAVIT, those students come to the EAC Payson campus during their what they call 0 hour. So at 7 a.m. those students come, and they have class from 7 a.m. until 10 a.m. Monday through Friday. and they go for a total of 2 years, so 4 total semesters. And those students have an opportunity, if they choose to go through Allied Health, they would get certificates of completion and then an ability to become nationally certified or registered through the state. There's 3 different ones. There's a phlebotomy technician. This is a newer program that we brought about 2.5 years ago. So phlebotomy technician, nursing assistant, and then medical assistant as well.
Oh, wow.
Yeah, so and those students who choose to come in through NAVIT, they would come in their junior year, and they're full-time college students as well as being full-time high school students. So they're in class from 7 a.m. typically until about 4:30 in the afternoon.
Wow, that's is a long time, but it's a great opportunity.
Absolutely.
It's a wonderful opportunity to where you can have that certificate
Yes.
by the time you graduate. So as you said, Ty, when we were out in the lobby before the program, they can go right into the workforce.
Right, and I think it's important to say right now too that Payson has a huge need, especially for
definitely.
certified nursing assistants and medical assistants. Just talking to Dr. Michaels, he's with Ponderosa Care just a couple of weeks ago, and he was just telling me how, just at his office alone, how many he needs of medical assistants.
Yeah, and it's pretty consistent that
Right.
the doctor's offices around town are looking for, Banner Healthcare as well, always looking for medical assistants. So the medical assistant program is, a 2-year program. They do an externship. There's classes that are associated with, dispensing or not dispensing, but giving medications. They take anatomy, physiology classes. So they're quite well prepared, and we prepare them again to go take those national certification exams. And it's something we are hoping that will continue to really build in the community. It's exciting for these high school students because they can graduate from high school and then they have straight away the ability to go into an entry-level position. But these aren't entry-level positions that are paying, $16 an hour. These are entry-level positions paying $30 an hour.
Yes, yeah, wow. And, we mentioned that high school students can do this while still in school.
Right.
But also, really, you see a lot of different age groups coming through the program, don't you?
For our CTE or career technical education programs in Allied Health, we have both adult learners and then high school students as well. Typically, the high school students are preparing for a career either in nursing or maybe they want to be a physician. I have one student who wants to be a veterinary. So, they can choose any of those things, I guess, after they go through these CTE programs. But we do have some adult learners who are wanting to come in, and they're not quite sure. And I don't want to say unfortunately, but what typically happens is if you take a class with me, I'll empower you to keep going. And so those students that I'm training to be medical assistants, nursing assistants, they like what we're doing so much on the EAC campus, they come back and they go to nursing school.
Gotcha.
They'll just continually try. So
You prime them. Heather primes them
yes.
for what we do in their nursing program. You talk about age. My youngest student to ever graduate was 20.
Wow.
20 years old, and here you are at 20 years old, and you are a registered nurse, and you have this wonderful career that's going to last you your whole life, 50 years. It's a great opportunity, great money, great benefits, and just a great life. And then my oldest student to graduate was about a year ago. She was 52 and on her second or third career. And it's amazing. Heather, she's talking about like segues into healthcare. It's amazing when you think about any of the allied health programs are really a segue into whatever. If you decide, I want to move on from MA or move on from CNA or whatever the case may be, there's so many different, I'd like to hope they do nursing, but there's so many different aspects to how that kind of transfers over to so many different careers, which I think is important, especially for our community.
Yes. Yeah.
And again, this morning talking with Heather Perry, the coordinator of the Allied Health Program, and Ty Jones, the coordinator of the nursing program at the EAC Payson campus. And if you're watching on our KRIM FM Facebook page, as Monica Ray Williams is, and she said, "There's my girl, there's my girl." Yeah.
Hi, Mom.
Oh, that is great. So the program also, we talked a little bit before the show about how your students in this program managed and is managing through the pandemic.
Oh,
and
yes.
You wanted to talk a little bit about that.
The thing, during the pandemic, many nursing schools and honestly students suffered for those couple of years. And what was going on was, as you all may be aware, that hospitals were closed.
Mm-hmm.
They were closed except to patients. They weren't letting family members in. That includes students.
Mm-hmm.
And due to the relationships that EAC had and still has with our clinical partners, our students were able to continue getting these clinical rotations during the pandemic. So we were blessed and still are blessed with significant positive outcomes, not just in the clinical setting, but also academic and in the lab setting. And so what we're finding now, as students are out and they're in doing their careers, our clinical partners, we always survey them. They report back to us that they're seeing how our EAC students are advanced over so many other students in the state, just simply because while other students were not getting any clinical hours, we benefited from that clinical time at various hospitals, not just locally here, but also down in the valley.
Well, and a lot of the nursing schools and the allied health CTE schools, they actually closed. So
Right.
I work with the Arizona Board of Nursing, and we have consistent discussions. So I mean, Ty's right. We utilize a lot of our clinical partners, Rim Country Health, Payson Care Center, Banner Payson Medical Center, at least locally here. But we were really in a position for the first year, for the spring and then the following fall semester of 2020, where the facilities for my programs were completely closed to students.
Wow.
So we had to create at least a process where they could have clinical simulations. So what that did for us was allow for us still to graduate students. We were able to graduate 15 to 20 students through both spring and fall, those years that clinicals were completely shut down, at least through my program. The nursing program, again, continued on as well, but hearing from the State Board of Nursing, we were one of the programs in the state that were continuing. Many programs just completely halted and stopped. So we were at least still able to provide that service. We have really, not only just great partnership in the community, but
we should mention
we work for a great organization that really supported students and supported us continue to do what we had to do to make things happen. And we're nurses, so we're innovative, and we created a lot of innovations. And I don't know, I think it put us into a position where
we have a state-of-the-art lab, and John Hancock is our lab director. He took, during the pandemic, he turned our lab into a hospital, and where students would come. Now, we were still getting clinicals and things, but there were some times where we were kind of off for a little bit. But he turned it into a hospital where students would come just like they would go into a hospital. They'd get a report from a nurse, they'd start taking care of patients, have to give a report, assess, and do all this type of thing. And it was very, very effective. So we had that going on too, and we were blessed. I mean, we have great MHA, a huge supporter. I don't know where we'd be, honestly, if it wasn't for people like MHA, Friends of Rim Country, Arizona at Work. Who am I missing, Heather? I mean, probably several
well, we have
more.
the SOAR Optimist Club. We have a lot of great organizations around town that provide
private donors.
Financial assistance. Yeah, and that's another good point too. Ty was able to secure a private donor and really improve the offerings within our lab significantly.
Yeah, people really, there's a lot of people in our community that understand rural healthcare and the crisis that this country is in right now in terms of having a critical need for nursing assistants, medical assistants, registered nurses, LPNs. Payson is no different, but we are blessed with this school locally here. And it's just since I've been here since 2015 when I was hired, there's at least right now, I would say 30 nurses working at the local hospital right now as a result of this program. And so that's why we're really blessed. People want to support us and help us because they understand the need that rural communities have for attracting nurses. As you well know, we have a housing problem here too.
Yes.
And it's hard sometimes to recruit, nurses and other healthcare entities to work here because of our housing. Well, these students that are in our program, they typically already have a place to live.
Mm-hmm.
So that aspect doesn't have to factor in as much as, let's say, trying to recruit somebody from another state or even down in the valley to come live and work here in Payson.
Mm-hmm. No, that's so true. And those are some of the benefits. You mentioned the facility, the program, what you've been able to establish there. And there's other benefits and really big financial benefits.
Oh my gosh.
Isn't there?
Heather, why don't you talk? Heather is really good about this aspect.
I just, we were talking about ASU, for instance. It could be up to...
You're a student. Heather is a student right now in her terminal degree.
That's true. I'm going towards my master's degree in nursing education through WGU. Now that's a really reasonable college to go to for your, master's and for doctorate and even bachelor's because the cost is low enough. But, for instance, to get a nursing degree, if you were to go to a state university like ASU, you could spend $30,000 to $40,000 per year. And here, I think the maximum that you can spend, I'm thinking like class fees, textbook fees, everything. It's less than $10,000 for the whole program.
Right around $8,000 for 4 semesters.
Correct.
Spring, fall, or fall, spring, fall, however you do it. But and then when you're done, you have most of the students. If they have debt, it's very little debt.
Yeah. Compared to if you were to go to a state university.
Tens of thousands.
There's other benefits to going to a community college too, and one of the benefits, in my opinion, is the clinical time. And the time that we spend at the bedside with our students is really significant, especially with nursing. In comparison to what they're doing at the state universities, they don't, how can I even phrase this? They don't do as much as our community college nurses do, and especially not our nurses on nursing students on our campus here.
We even have at least 4 students right now in our program that are from ASU. So we're really blessed. We partner with ASU, and so it's nice. It's kind of sort of a pilot program, really, where we've started this semester, and we're really happy because ASU is a big school. They can only take so many students, and so now what's happening is some of those students are coming to Payson to start their nursing.
These nursing schools, even the community colleges, Mesa Community College, Scottsdale Community College, these community colleges in Maricopa County, they have wait lists that are 2 years. Yeah. We don't have a wait list. Yeah. We also have the #1 program, I believe, Ty, is that still accurate? The #1 nursing program.
We've been #1 many times, but currently right now, where we sit at a 96.6% pass rate coming into the semester, but right now, we only have 1 student left to take the boards from last semester, and that we're at 100%.
So, and that's 100% pass rate for those students the first time they take the boards.
And this is the caliber of our students in Graham County and in Gila County. We have excellent students that do very, very well. And it's important for our communities to understand that we have a great, it's hard. Let's not, beat around the bush. Getting these degrees is difficult, but our students continue to pass. 100%. That's a tough thing to do, but they do it, and we're real proud of them. Especially here locally in Payson, we have great students that come into our program and are highly successful.
Yeah,
and now continue to work.
They're there at Banner Payson Medical Center. Something else that I don't remember when we had this conversation, someone from Banner Payson said Banner really benefited, Banner Payson Medical Center really benefited from our nursing students because where there were hospitals around the state that were having to staff their hospitals with travelers, we didn't have that issue as much here in Payson because these are local homegrown nursing students who are then going into work at Banner Payson Medical Center. And again, we have a significant amount, not only nurses, but we have phlebotomy technicians that have completed their program here on this campus, nursing assistants who've completed their program here on this campus in Payson, and then medical assistants that are working in the field too. So, it's exciting.
And our nursing long-term care facilities too benefit from that Payson Care Center
and Rim Country
Health.
Right.
Yeah, they both partner with us as well.
And no, I have to say, my experience just this weekend. So my son and his wife, she just had their second child, and he was born on Friday night. I had to be flown down to Banner Desert problems, but in Scoops when we had it and was in the program, and then she directs me and takes me to back to the I don't know what is
OB.
that? OB.
Mm-hmm.
And here's another one of the students,
Right.
former students that's working there.
Yeah.
She said, "Oh yeah, I had to leave last night. How did everything go?" And it's just you really see that.
Isn't
You
that
see-
nice? Yeah, I agree. And then to have those people in the community that you grew up with. And when I was working at the bedside at the hospital, I took care of my friends' parents, my
Mhm.
friends,
Mm-hmm.
my neighbors.
Mm-hmm.
I don't know, it was just such a pride in doing something like that.
You can't go to Walmart. I mean, it used to be a lot more
Sure.
for me when I was at the bedside. I've been at the bedside, obviously I teach now, but, everybody knows you.
Everybody knows Ty, and Ty still to this day. When was the last time you were working at the bedside?
15.
In 2015, and here we are in 2022,
Yeah,
7 years later. Ty consistently, when we're out in public,
Uh-huh.
and he doesn't want to mention it, but I'm telling you, people recognize me. Oh, you took care of my family member.
Yeah.
You took care of my wife, my daughter, my mom. So people, I don't get that.
Uh-huh.
I never
But-
get that.
So Ty
I should.
Ty gets
You
that.
should, I know.
Ty gets that in the stores, but you get the comments on our Facebook Live.
Oh.
This one. See if you can guess. Well, I won't
Alright,
put you on
okay.
the spot.
This is
But
great.
that's my best friend. I'm so proud of all your hard
Wow,
work.
I have a few best friends.
I know. That's why I don't want to. Amanda Blaylock.
Oh, that is my best friend. I went to high school with her. I have a handful of best friends
Yeah.
that I grew up with around this town. Thanks, Amanda.
Yeah.
I
So
thought,
I'm ready to watch it.
okay.
Oh, you
never
thought I
mind.
was your best friend?
No.
We
come
are
on.
best friends.
Yeah, but
So I said I have a few.
We're like brother, sister more.
I guess so, yeah.
Yeah, you're like old best
Yeah,
friend.
we play off each other.
Right, yes.
Well, I remember the time when Heather graduated, I couldn't get her to come and work on my floor fast enough, and I literally took the application down to Starbucks
Yep, I was working
and
at
handed it to
Starbucks.
her and made her fill it out.
I was taking some time, it was such a rigorous
Uh-huh.
program.
Yeah.
Yeah.
And I wanted to pretend like I was living at the river
Yeah.
that summer. And Ty said, "You have to apply. When are you applying?" And I said, "I don't know." And he showed up the next day with a.
With an application.
Now this is in the day of paper application.
Yeah,
So
yeah.
he said, "When's your break?" And I said, "Oh, I don't know. Maybe 10 more minutes." And he waited
He
for
just
me.
waited.
And then he sat down and
Fill it
said, "I'm not leaving until you fill this out." So.
Oh, that's great.
And then when I came to work at the college, it was kind of the same thing that
Uh-huh.
Ty recruited me to come work in the nursing program initially, and I was working as a skills and clinical instructor.
You were still living in Colorado when I
When
was
you were
texting
trying
back
to
and forth with you.
recruit me.
Yeah.
Yeah. So and this is a great example. All of these, stories of the wonderful community we have here.
I agree.
The wonderful community, how close knit the community is, and how it supports. There's so many different programs and people in the community that support each other.
Right.
And that's what allows, these things to happen. So you have a little town, Payson, population 16,000, and basically the best nursing program in the state.
I
Right.
so agree.
And then also too, we can say the same thing for Graham County, the Thatcher campus and the Globe campus, these community connections that we have,
Mm-hmm.
because we're like triangular.
Mhm.
We're one entity composed of 3 different campuses.
Mm-hmm.
One in Thatcher,
Mhm.
I call it the big campus, and then we
Mhm.
have the one in Globe,
Globe,
and
mhm.
then the one in Payson.
Yes.
And we all have those relationships with that. I think it's great. Yeah.
Yeah, I agree.
And we have another comment from Rose Henderson.
Oh, my other best
Right.
friend. Thanks,
And,
guys.
Rose, a pillar of the community.
Oh, my
with
word.
the heart, with the heart too, with the heart.
Thanks,
yeah.
Rose.
Oh, that is great. So there is a fall program that is starting, I believe April 1st.
Well,
is
yeah,
the
and
deadline.
we have MHA to thank for that
Mhm.
because they are making the funds possible for us to have year-round now, where before
Mhm.
we could not do that because of
Yeah.
finances. And I had to sit down with Dr. Michaels at the time, who was with MHA,
Mhm.
and I just explained to him, hey, this is really what I would like to see happen in Payson, to be able to have students come in every semester rather than have to wait
Mhm.
for the next semester. And then we met with MHA, and they made it happen. And we've been benefiting from that now for over 2 years. The Payson Hospital actually, and the long-term care facilities actually have nurses currently working in their facilities right now that would not be there if we weren't able to have this year-round
Right.
program. It's
Wow.
it's really incredible.
So
Again, community support.
Yes.
The deadline to apply for the nursing program is April 1st. Now, you do have to have some prerequisites
Right.
finished prior to coming in.
Mhm.
Things like your basic English, some math classes, anatomy and physiology, microbiology, pathophysiology, some heavy classes. But you're prepared for that, and then you come in and then you can apply to enter into the nursing program. Again, we don't currently have a wait list for our nursing
Mhm.
program. Allied health classes, we start all over again in the fall, and so
Mhm.
you could really enter into any of those three career technical education sort of pathways, which is medical assistant,
Mhm.
phlebotomy technician, and nursing assistant.
Mhm.
We have summer classes, we have, of course, fall classes.
And you can do it all without ever leaving your
The
living,
community.
the community.
Mhm.
You can do it
You have to
all
leave
right
your
there.
living
I
room.
know.
Without leaving your cat. No. The
You have
community.
that.
Right.
Yeah, the community.
Yes.
And as you pointed out,
Yeah.
Ty, again, you graduated someone as young as 20 from
20
the
years
program,
old, yeah.
and as senior, I don't want to say as old, as senior as 52.
Yeah.
So if you're listening and thinking about a different career,
Mhm.
you want to be involved in something different, you're tired of what you're currently doing.
Mhm.
Again, it doesn't matter if you're in your 20s, 30s, 40s,
Mhm.
50s.
And you can branch out and do anything in nursing.
Oh yeah,
It's so
Absolutely.
diversified.
Mm-hmm.
leadership, teaching. I mean, gosh,
Law
there
even.
law. Yeah, I mean,
Yeah.
and you can. There are so many different. What the new thing is nurse entrepreneurship. So I have a really great friend that I worked with at Mayo Clinic, who's created her own home-based service of nurse
Mhm.
concierge service,
Mm-hmm.
and I'm incredibly proud of her. But just she's such an example to me of someone who can be an entrepreneur. So I mean, if you have the drive, there are so many different avenues that you can go to,
Mm-hmm.
Yeah.
and again, it's very exciting.
Mm-hmm. So I have to say the Facebook Live is like Heather's.
Is it a Heather fan page?
Heather's virtual Walmart.
I'm
when,
not
when you
surprised.
go,
I'm not
yeah. so Ty, when you're in Walmart, you get all that.
I
Hey,
know.
hey, hey.
Yeah, I
but
do.
but
Yeah.
My
Heather,
friends are all on
I do.
Heather,
Facebook.
yeah. So a comment from Angie Neal saying Heather is an amazing teacher.
Oh, thanks,
So,
Angie. You're so
there you go.
sweet.
But now we might get a comment here. Let me see. Ty is great too.
Oh,
That's what it is.
I
he's
just-
okay.
and then we have somebody
Yeah.
I don't know, might be related, a Guy Jones.
Oh,
yeah.
maybe
That's
related.
my twin. He
Yeah.
he runs Community Bridges.
Yeah.
He's doing a great job over there too.
Yep, and he says hi to both of you, Ty and
Yes.
Heather.
Hello.
So
Hello.
there we go. No, well, thank you so much, both of you, for coming on.
Thank you for
Thanks for
having
having
us.
me.
Yeah,
And
very exciting to talk about
Yes.
and thank you for all of the passion, the energy, the commitment to this program.
this. Thank you.
That has had just an amazing impact on the community and to everyone in the community,
Yeah.
because we all at some point there's going to be a time when you have to go to the hospital, one of
Yes.
the clinics somewhere,
Mhm.
and this program has been such an integral part
Yes.
of feeding and providing the nurses and
This
the
is what
CNAs.
drives us.
Yeah.
And Ty and I both growing up in this community, to me, the driving force behind what I'm doing is to educate future healthcare providers who are
Mhm.
going to work in the community with me, take care of the people I know and love. And it's important for me. And so I love it. I don't think I'm bragging on us. I don't think you're going to find instructors like us anywhere. And I mean, I'm good looking. Ty, you're okay. So there's that too.
I know what I'm dealing with. Believe me, I know what I'm dealing with.
I know what I'm working
Ty and
on.
I are realists, okay?
Yes.
We don't try and, convince people,
No,
there's
no.
something there that isn't, it's kind of, you get what you get. But also, Guy saying, great show, you guys, thank you. And Angie Neal says, you got that right, Heather.
Yeah.
So,
See, I mean.
well, thank you again so
Thank
much
you.
for coming in.
Thank you so
Great
much.
program. And also, more information, I think on the nursing program, the best thing to do would be to visit the EAC website.
Yep, eac.edu, but you could also call our campus, and if you want any advising from either myself or Ty, you
Mhm.
can contact the EAC campus at 928-468-8039. And we're ready and available. We want to help to ignite a passion in healthcare like it was ignited for us
There we
Right.
go.
so many years
Right.
ago, a long time ago for Ty, but
Mhm.
not that long ago.
Yeah.
Yeah.
Yeah, all I have to do, and all you have to do
Somebody
is,
has to mentor you.
Yeah, that's true.
and right there on Mud Springs Road. So
Correct.
Yep.
so
Yep.
easy, right here in the community. You don't have to leave.
Yep.
So
Thank you.
wonderful. Thank you again, and thank you everyone for listening. And a big thank you to Desert Financial Credit Union also for sponsoring our Community Spotlight program. We're getting back to the music here with some Smash Mouth, Pat Benatar, and John Hyatt. But first, an update from the National Weather Service.
Forecast for Payson.
All right.
All right, nice.
There you
Yeah.
go. Alrighty. Let me cancel this or stop the live because a lot of times I get talking. We're like, hey, this and that, and then, ooh, the live